Oh, that's why.
Per town charter.
So we'll push that till Pammy gets back.
I would say, yeah, I think that's fair.
It's okay.
So when?
Pam gets back.
Yeah.
That's all of us here.
I don't belong to any group that has to do once a year. It's usually like every 2.
This is an important board.
Well, no, I didn't realize it was mandated, so of course you have to do it.
We receive our police powers from the governor.
Huh?
We receive our police powers from the governor, not the board of selectmen. Did you know that? We just need to be compliant, right, Larry?
Yep. Well, it's important. What the heck, it's not a big deal. Doesn't change much.
It matters when it matters.
Well,
Okay.
I mean, it's not a big deal to do it, to discuss it.
We can discuss it.
Yep.
See if anybody has
Many
any
more hot
feelings
buttons.
on it.
Sure. Shall we get underway?
Yes.
7:30?
6:30.
6:30. Call the meeting to order.
Big crowd tonight.
Should we discuss the, do we have to open the meeting?
Open the meeting.
I'll make a motion, we open the meeting. Forgive me, I'm new to the chairmanship, carrying the Roberts rules all week long, reading them. I'll do my best.
We don't have anyone to
You got Megan to,
call, so.
Thank
Yeah.
you. Feel free to speak up and interrupt. We're out of order.
And you can say, as required by law, we are audio and videotaping this
As
meeting.
required by law, we're audio and videotaping this meeting.
And any person intending to either video or audio tape this session needs to inquire if that's okay with the chair.
Any person also videotaping or recording this needs to inquire with the chair for permission to do so. Thank you.
huh,
I'm not.
Excellent.
Thank you. Should we get underway?
We should.
Go to start.
Sure. The first item on the agenda is reorganization of the Board of Health. This is a charter requirement to be made in July of each year. We don't have a full board this evening. You can make recommendations or move to promote or change positions if you'd like tonight, or you can put this off till next month.
Well, I think we ought to have a full board before we make
yeah,
any decisions.
especially the chair.
Yeah.
Absolutely. I'm in
Yeah.
agreement with that. So
Yep.
I'll make a motion, or could we hear a motion to push it off?
So moved.
And I'll second it.
Right.
It carries.
All in favor? Aye.
All right.
The second item is the minutes of the previous meeting, which was a regular meeting from June 12th. We only have 2 voting members available tonight to vote on those minutes. Pam is missing and Cynthia was not at the last meeting, so I don't believe we have.
So moved that
we-
we accept the minutes of July
Well, I don't think
12th.
we can. I think there isn't a quorum to do so,
We
so
don't
we'll
have a
have to
quorum. Okay.
push that
I
off till
unmove
next
Yep.
meeting.
Okay, so
Well, that's easy. We're moving right along.
that's great.
And then the next item on our agenda is a review of the fiscal year 19 VNA contract. Every year we get a contract from the Visiting Nurse Association that requires approval from Board of Health as well as a sign-off from the chairman of the Board of Selectmen. This year's contract is extremely similar to last year's with their duties that they can be contracted to do for the town, the maternal and child health services. Those are home visits for newborns and new moms. They're usually covered under most health insurances. However, the ones that fall through the cracks still get that visit from the town and we pay the difference. They rarely but can do health promotion wellness sessions. We do have our own town nurse that does those twice a month at the community center. But if there's a reason to hire the VNA to do them separately. We have that in our contract as an option. For instance, there was a Hep A outbreak, I think it was in Michigan, and some of the other towns got together and did a Hep A clinic and a wellness seminar for food service workers. Here on the Cape, the county ended up doing something like that, so we didn't have to do it separately, but it's nice to have the option from the VNA to be able to have them help us out
Yeah.
for larger things like that.
That sounds good, some flexibility.
Another thing that they do for us frequently is our communicable disease surveillance and follow-up, from anything from Lyme disease to salmonella and everything in between. Any communicable disease or reportable disease gets referred directly from the doctor or hospital nurse to the VNA, and they do all the legally required input to the MAVEN system, which is an electronic database of all Massachusetts reportable diseases. So they are our MAVEN contractor for that.
Before you go to page 2, is it okay to ask 2 questions now from
Absolutely.
the front page? I
Mhm.
have 2 questions. One of them is A, small a, about the visits not to exceed 3, or somebody in the town approves it. Who's the person in the town government that approves that?
That would most likely be me. I would need to know why they needed more than 3 visits and why regular insurance wouldn't cover it,
Oh,
or if there weren't any other avenues. I would confer with Sue Giselle, the town nurse, to find out if she could possibly supplement rather than the VNA.
okay. All right, and then my second thing on health promotion is, depending on what the issue is, I would say mental health, for example. Who does the VNA have on site or available to do mental health services? And then B, if it's something to do with prescription diet, like some specialty diet for children, celiac or diabetic or whatever, who has the qualifications beyond a nurse to be able to, do they have a system set up so they can refer somebody out, for example, to maybe Cape Cod Hospital to get the appropriate mental health provider or a registered dietitian to do those services? Is that a possibility?
We can ask about that. I do know that Lauren, our summer intern who works at the hospital, is pairing up with Sue, our town nurse, to do a series on blood pressure and healthy eating and diet and exercise, that sort of thing. She does have contacts with the hospital. The VNA obviously does have contacts with the hospital too. If we requested them to do a specialized clinic, we would make sure they have the right people there. And
Yeah, that's good, because basically the insurance should cover if it's for the diet part anyway. I didn't know about the mental health, because there's a lot of people that do nutrition who are not qualified, and so I'm pretty concerned about that. And then with all the, what we're reading about mental health issues and opioids and all, I would hope that the people who are doing mental health intervention are people who have skill in that basically in some way are certified, or that we could refer them to somebody locally that has those skills. And I don't know if it's appropriate to look in, or you feel very confident that the people that they're using, in fact, are certified in these 2 areas of diet counseling or mental health services, in fact, are qualified.
well, we don't use them currently, so it would only be if we did a special request for
Oh.
a wellness clinic.
Okay,
We don't hire them to do them on a regular basis.
yeah.
So
Well,
if
they
we
could be
wanted to-
referred, it's like a partnership, and I don't think it's appropriate probably, or money-wise, it's not it wouldn't work to think that the town or the VNA itself might do it, but I think that there should be some referral system so that the client gets the best qualified person to do it. So I don't know if that's something that they do, that would be
I
great.
don't know, yeah, I
Yeah.
can look into it.
I know,
and
for
find out
example, at
more.
Fontaine, they don't have any diet counseling services. I don't know about mental health, but I just think it's a good bridge that we know that the clients who need further help and hopefully have insurance, that we get them to somebody who's qualified.
Mhm. And if they don't have insurance, that there's some kind of safety net kind
Yes,
of thing.
mhm.
I
Sure.
think
What would you
there's
say?
one CMHP at Fontaine
Mhm.
who does that,
Hmm.
and I think she's the only one.
Hmm.
At least that's the way it was last year.
Mhm.
Yeah. Anyway, I just thought I'd brought up as an issue, because it's something that I feel that the town should be
Mhm.
supporting the best standards here.
Mhm. Absolutely. We can, I'll touch base with them and see what kind of credentials they have.
Yeah, good, thank you.
Other parts of the contract, should we require them to do an immunization clinic or any sort of other wellness clinic? They are responsible for bringing those supplies, like syringes, alcohol swabs, Band-Aids, little incidentals. And the other thing that has changed is their rates. Our appropriation is $5,000. That's the budget line item for the VNA. This year, we did not exceed that. We were in the lower than $3,000 range. So they did increase their hourly rates.
They increase them?
They increased their hourly rates. So.
To what? Are we allowed to ask that?
Yes, we can discuss that. They say they've increased their rates for the first time in 7 years.
Oh, okay.
So that's, let's see. Their
Somebody here
rates.
must know what that is, right?
The rates?
Obviously, who reimburses them, they must know what the rates are and the increase and all that.
For instance, I thought it was in here, the surveillance, the communicable disease surveillance and follow-up used to be $85 an hour, and now it's $95 an hour. And they do charge in 15-minute increments. So if they get one case and it only takes them 15 minutes to input the information, they only charge us 15 minutes. So a portion of that hour. I thought they had their rates in here.
And why do you think that there's less cases? That the case load went down? Is there any estimate of that? I would think that it would have gone up. Because they have such a nice range of services that they offer.
Mm-hmm.
But, I mean, it's not that it is what it is, but it's just interesting that it would have gone down in this day and age where we have so many problems with families with hunger and opioid use and infant care.
Well, I shouldn't say most, but quite a few maternal and child health visits are covered by private insurance.
Oh.
So we wouldn't get billed for that. It's the ones that don't have insurance.
Okay.
Or
that
they're
we
all in
get-
Mass Health, and they get
Or they're
to
on-
Mass Health 100%.
Yes. So
Okay.
it's
There's no
pretty rare to have
out of
someone.
pocket for them.
So basically, there's other sources of reimbursement for those
Yes,
services, what you're
yes. So
saying,
those
okay.
services are still happening, they just
Someone
don't
else
need
is
to
paying
come
for
through
it,
us.
yeah.
Yep. Mhm. And communicable disease and surveillance, that's steady. We do a few of those a month, every month.
So that's in their increase, we could absorb into our budget without an issue.
Yes, I don't believe that we'll go over our budget because of their increase. I think we'll be able to maintain the
So we
same
got
level
three-
of
we got
service.
2 on it, and that's,
So what percent is that? I mean, I think it's $10 is reasonable, but what percent?
Mhm.
I'm not a mathematician. What percent raise per hour is that?
from 80 to
85 to
95.
95, 10%.
Hmm.
Yeah,
Do you remember
Pretty
seeing
good.
it in here?
Yes.
right?
'Cause she did-
16 would be 10%.
No, I never emailed with her. I'll find out what they were specifically, because I do remember seeing them, and I thought they were in the agreement.
Is that, not to prolong this too much,
Mhm.
but is that 10% raise for that within the usual range of other contracts that you have to give an agency a 10% raise in 1 year. It's been 7 years, so obviously if they were getting 2% or 3% a year, it would have added up to this, so that's really not the issue.
Well, the only other contract we have is with our contract soil evaluator.
Oh,
And his rates increased a year ago, and he went from $50 an hour to $65 an
no,
hour, and
so
that
it's
went through.
kind of within the range, okay.
yeah.
All right, thank you.
Sure. So we need a vote to,
Can we vote? Do we have a quorum to vote?
you do, yes,
Yeah.
you're all here for this. The minutes, you can't vote on minutes of a meeting that you didn't attend.
Oh, okay.
But we could vote, we'd have to be in a agreement to have it pass because we only have 3. Would that be
Tonight
right?
for
Right.
tonight's.
Yeah.
No, you can have a two out of 3.
Oh, okay.
Yeah.
I'll entertain a motion that we accept the minute, the.
I'll second it.
Okay.
No, your turn to move this.
Oh,
time.
okay, I'll do, so do I make the primary, or do I second your motion?
No, I would just.
Okay, I'll
Or
have
your
to, yeah,
motion.
I'll make a motion that we accept the proposal, to accept the contract as written.
So second the motion.
All in favor?
Aye.
Passes unanimously.
And it will go to the Board of Selectmen for their review
Okay.
and signature. Well, we have,
We don't need to close out that hearing. Do we open and close things as we go along for votes?
you can, yeah, you should between hearings.
Yeah, so we'll close the hearing
Mhm.
for that.
And we don't have,
Should we do the
not quite
work
7.
session?
Yeah, we can do, that was the work session, so we'll do the report of the health director,
Sure.
okay? Let's see, so June started the summer off with beach sampling. We have our beach sampler who is sampling our beaches on Wednesdays. Last week, she sampled on Monday because of the holiday, and so far, so good with no exceedances.
Excellent.
This is a dumb question, but what is she, is it the sand, or is it the water, or both, or what?
The water,
Oh,
the
good.
water. She'll test the pond as well as the ocean, any public or semi-public beach for bacteria.
Good,
Yeah.
okay, yeah,
Mhm.
interesting.
Barnstable County is providing us with the person to do that sampling, so we thank the Barnstable County Health and Environment Department for that.
Very nice.
I attended an emergency management tabletop exercise with the town. Lee Culver, who is our emergency management director, organized a tabletop exercise that was well attended by town staff, and it was put on by the Mass Maritime Academy. One of the graduates, one of his projects to graduate was to oversee a tabletop. And we did the tabletop exercise, and it went well. All the town departments worked well together. It wasn't public health related as much as
What's a tabletop? Obviously, it's not a pie.
a
As in tabletop pie, what is it?
Um,
Problem solving, group?
it's a group exercise to go through your emergency plan for a specific incident.
Oh.
So we pretend an incident is happening, and this time it was a hurricane in the middle of August. And we go through which departments do what, who calls who, what is the process through that, what happens when the tide comes up and all the boats are in the middle of Lower County Road, and then there's another incident of an oil spill or gas leak from boats in the water. So they start with the hurricane's coming in 5 days. What are your preparation steps? And then, okay, the hurricane's 6 hours away. Who do you call and where do you go? And it keeps going until a few days after the incident, and what everyone's recovery systems are, where our department stands, beaches, harbors, fire, police, even the town planner and community center staff were at
I think that's essential
It is, that is really
and
forward.
terrific.
It is.
Because of, it cross-references all of our problems.
Mhm.
A snowstorm, a hurricane.
And is that mandated by the state, or we just do it?
We are mandated by the state to do tabletops through the public health emergency planning. This one wasn't public health centered, but we were involved because there was a power outage and food service was down and inspections, no running water and things like that. So we did have quite a big piece in it, but we will have another tabletop like this specific to health within the next year.
That is great.
Yeah, yeah. A year ago, we did one in the town of Brewster. We participated because that specific incident crossed town lines and things like that. So we get together and run through our emergency plans at least once a year.
Nice to have, put all faces with the names when we're in a crisis. Everybody knows exactly where to go and
Yeah.
takes the guesswork out of it. It's great.
It is, because we've had a lot of turnover in staff too, so there were some
Yeah.
people that didn't know what to do when, and that was good.
And I think the weather is getting more severe, just as a sideline.
Yeah.
Tornadoes in
Four
western
nor'easters
Mass.
in a month.
Yeah. It's picking up.
It is.
Communications, okay? I mean, do they have, wireless communications?
They-
Well set?
They do. They have two different types of radio systems at the police department. One shortfall was, I don't have access to that communication,
That's what I was
so
wondering, yeah.
unless I'm given a handheld radio before the incident,
Yeah.
it's kind of hard to talk to someone who doesn't have your own
So
communication.
is there any way for emergency workers to communicate one to another?
Yes, yes,
Do they
they
have
all have that system.
walkie-talkies?
They're like walkie-talkies, yeah.
Okay.
Very high-powered, expensive walkie-talkies.
And could we, somehow, if we save money on something else that the Board of Health or the town does, they could buy one for the Board of Health? Is that appropriate?
A few years ago, the Barnstable County Health did that with a grant. They had a grant and got every town health department, it's called an 800 radio. It's, we hardly ever used it, and it just sat on a shelf. So I think a
Oh.
better use would be to have the police department to just have a few extra to give whoever needs them. And they can maintain them and use them throughout the year to make sure they work.
Yeah.
They've got a big budget.
They do have a good budget. I did go to a couple of wastewater support committee meetings over the last month. The town administrator would like us as a board to look into fertilizer regulations. I know this came up probably 5 years ago. Part of the comprehensive wastewater management plan addresses fertilizer and how that nitrogen source can affect the nitrogen levels in our watersheds. I've looked at some regulations for other towns. There's something we can look at. There's two approaches. One is the educational model, where we don't have an actual enforceable regulation. It's more, this is the best practices and this is what you should do. Or we could go the route of what Nantucket did, and if you use too much fertilizer, you can be fined. I'm not really into being the fertilizer police, but it really depends.
I'll agree with that, because we did go around quite a bit on this topic before you both were members. And I think that the education part is underutilized. I don't think people realize that they could be affecting the groundwater. And if that was more prevalent, especially with our new high-tech outreach programs that we have, we might be
Yes.
able to bring more people along.
Mhm.
Because the flip side is you have to go out and enforce it, and who's going to enforce
Who's
it?
gonna do that? You don't have
you know.
staff. But maybe it could even be, make a recommendation to do it, whatever you think is appropriate, like every 2 years or every year, so that all the newbies, or some of these McMansion, or the newer property owners who may not realize that this is an issue, could take advantage or be sent information so that they're up to snuff about either themselves or the people they hire for their property, know what to do.
And some towns do an educational program for landscape companies,
I was
or
gonna say, yeah.
the applicators,
Yeah.
where they have to pass a little few-hour exam test kind of thing, where they're educated on the use of it. And then they have to maintain a yearly or 5-year certification that they've taken the exam.
Does anybody know what those tanks and True Green and all those people contain? I mean,
They have a license, a
I know,
pesticide
but-
license, so.
we ought to know.
That's all under DPEA, I
Yeah.
imagine, or else.
Yeah, EPA approved,
Uh-huh.
DEP approved.
TEP, that's it. Yeah.
What I would suggest if they don't have this is whatever training is, that it be in more than one language. At
Mhm,
least
mhm.
be in Spanish.
That's a good
So
point.
that,
It's not
folks
so much
who-
the applicator that's the issue, it's the person selling it. That needs
Um,
to have an alternative to sell.
And
Well, I was thinking it was more, well, it could be, what about the people who hire landscaping folks? I think it would be good for them to be informed, so they're hiring companies that use, not evidence-based, and maybe you wouldn't call it landscaping, but use best practice. I think the homeowner, especially people with large lawns, are supporting companies that use the best practice, because it's not only the water that's being helped, but the people who they hire could be at risk for having all these contaminants on their body too.
And studies have shown that it's actually the backyard homeowner who's applying it is doing it improperly, because the landscape companies are certified at some level, and they actually would probably like to use less than more, because it's cost effective for them. So it's more of the homeowners that go to Agway to load up on their fertilizer and then distribute it at the wrong time of year, too much, and then it all runs off into the ground.
What we could PR it, like you're saying, Frank, is that there might be some way to put some of the information on the web, or PR it in places where people go, like, where people get their hair cut, predominantly, I hate to be sexist, but barber shops. They do a lot of that kind of stuff in Boston. They use barbers to deliver a lot of health messages that, like man-to-man kind of idea, but it might be, that's one avenue that might be good, so that the people who are, like you say, not doing this as a business, but are the weekend warriors, would have access to the info.
There's a big Barnstable push for this whole thing, too.
There is.
That's
Big what push?
A big Barnstable push that's already ongoing, that they're trying to bring regulation to it. So there's a lot to it. They're doing
Well, that's
both
good.
education and trying to do regulations, and that's where they're trying to get us involved and be on their regulation side of it. At least that's what the history's been on this thing. And, we could talk about it some more.
Yeah, it'll come up again. I'll do some more research on it and tell you what I've been thinking and get some more input. We'll have it on as an agenda item so we can have.
This would be a fabulous grad student project.
And
If you happen
Maybe
to
next
get
year.
another one next summer.
Yeah, next summer.
It takes a small bite, as I understood it at the end, out of the big pie picture.
It does.
So the climb might not be worth the view, so to speak, when you look at the total aggregate problem and what we're spending and doing, that fertilizer is a small issue.
Going on the wastewater line
You
of.
disagree,
I disagree.
and there's a lot to be said about it. But I'm going back to the information that we worked with 4 or 5 years ago through Barnstable. Would you like to make a comment?
Yes, I would.
You're free to.
I'm supposed to be talking about nitrogen in a few minutes, but.
Well, why don't we
one
wait
of
till
the
the,
things I was
why
gonna
don't we
say
wait
is
till,
the nitrogen
excuse me,
phenomenon-
why don't we wait till the end of the work session, and then we'll take that,
Okay.
we'll hear that,
Yeah.
Yeah.
just to
I
just to stay in
actually,
order.
Had some knowledge of a company that made or non-nitrogen bearing fertilizer. It was actually ground up rock, and I can talk about it.
That's great,
Okay.
thank you.
Other wastewater news, we drafted a letter and sent out to all of the Phase 2 properties that gave them a little detail of where we're at after the vote in May. It said, these are the steps you're gonna be asked to make in the next couple of years. The wastewater support committee meeting, the committee felt there was a real need to send out a notice to all the Phase 2 properties specifically, not just a draft, not just a flyer of some sort, but something addressed to them saying, you are in phase 2, you will be sewered.
I have gotten 2 things. I've gotten something from Coastal Engineering as well, for an invitation to go see something. I'm on the list, the early
Yes, lucky
adopter
you.
list.
Yes.
So far, 2 things have come through the mail. I'm saving everything for us.
Yes, Coastal Engineering met with us yesterday with questions about phase 2. They are doing a community meeting. It's not town sponsored. We're not going. It's not something the town is promoting because it's a private company.
It's a private company.
They're being proactive.
Seeking active engineering contracts.
Yes.
I
yes.
see.
So they probably won't be the last to do that, to send out flyers as far as an engineering company goes.
Mhm.
But we did meet with them and told them that we think they're kind of jumping the gun at this point, but if they want to get contracts, they can.
I think people are anxious. I've had a lot of people in my neighborhood, they're like, what gives? It's like there's a lull. They had the great meetings, the town meeting, all that good information. Now we're in a lull, and they're thinking that a lot of the stuff that's happening on all the roads all the time, it seems like
Sewer.
every major road around here, Old Queen Anne and now Depot, and like they think that that's part of it. They don't understand that that's not the sewer system. So I think I'm not endorsing them jumping the gun, but I think people are kind of like, you know, what's the next?
Yep, it'll get people thinking about it anyways. We have fielded quite a few phone calls and stops into the office about it. So people are aware and
That's
wanting to
good.
know more information. And I did go to the Harwich Chatham sewer meeting as well. So Harwich and Chatham are talking regarding the sewer line going down Queen Anne Road. We share the road, and the sewer line is going to be installed and maintained by the town of Chatham and not by the town of Harwich. Little happy dance for us. The connection to the houses in Harwich will be connected by Harwich, but that part of the plan was figured out, so we don't have to worry about that. What we're working on now is where the pumping stations are going to be. So there's 6 pumping stations in Harwich that need to be located where all the sewage will collect and then be pumped back towards Chatham. So we need to secure properties willing to put a pumping station on their property or sell land to the town, or somehow there's 6 locations that are going to need to be worked on over the next year or so.
Who's driving that? Our water department?
Our town administrator and water commissioner are both
Okay.
working with property owners to figure out where the best place will be.
Is a pumping station a big structure, or is it all underground?
There's
or-
2 kinds. One is above ground and one is below. Depending on the location, they prefer the above ground one. It's easier to maintain the pumps, but it looks like a shed. It's
Mhm.
maybe a 10 by 12 shed,
Mhm.
and they will landscape around it so it's not ugly.
There's no venting or anything like that, or is there?
There is, and there's working pumps and a generator that needs to be exercised once a week. So there's a little noise, there shouldn't be any odor, but it'll have a stack on it.
Yep.
Same thing with the one that's underground. The structure won't be as big, but there will be something over the cover of it, which will then have a manhole. People will go down and work underground just like they do with underground utilities now.
Yep.
So if some committee makes a decision where they want these 6 places, and some of it, and let's say, just say, from one of them is on somebody's property, is it one of those that they can take it by eminent domain, or what rights do landowners have if in fact they are not interested in having it on their land?
I don't know if Larry can answer that question.
Well, we're hoping not to go that far. I think
Yeah.
Chris mentioned last night that he's had good discussions with 4 of the 6
Oh,
of paid easements, and so I think it's more right now a budget matter of paying the landowner for easements to put
mm,
the structure on the property.
mm.
I suppose in the end you could go that far. But
Mhm.
that would certainly-
But that's great if you already have 4 out of 6.
So food, that part's, I
Good.
think, is really positive.
It's good, it's positive.
Good. Moving away from sewage to food, I had a meeting
Great move.
with,
Direct connection, right?
with the owner of Perks who would like to begin serving raw shellfish. To do that, he has to have an approved HACCP plan. It's a hazard analysis critical control point plan. Does not require a Board of Health approval or variance to do that, but they have to show me an acceptable HACCP plan, and right now it hasn't gotten that far, so he has not received approval to serve the shellfish. He wants to do oysters, clams, and then tuna and mussels. The tuna, I said, is probably the least of our problems because it comes vacuum packed already, ready to go on a plate. But the shellfish takes a lot of water use to clean, and it is very, very temperature dependent for safety. And being able to prepare in one place and shuck in another and not cross-contaminate in that one place is hard because his facility is pretty taxed as it is.
I thought that those plans, the restaurants have to comply with them, correct?
Yes, that's what he is.
And when we, I don't think this is talking out of line, maybe I won't use the restaurant's name, but last year when a very small facility in Harwich Port had raw fish, we were pretty strict with that facility about how
Yes.
all the seafood is handled, and so if we were strict with one, are we gonna be equally strict with this group?
Yes, and the difference with that was sushi. And the reason for Board of Health approval for that was because they were and are doing sushi rice, so they're preparing a potentially hazardous food and allowing it to sit out at room temperature, not under temperature control. So that requires a special variance from the food code. Serving raw food isn't a variance. It's something that requires a HACCP plan. Same thing with sous vide. I don't know if you know anything about that, where you partially cook something and vacuum pack it and then cook it again.
Very trendy.
It's very trendy. That's something that is a special process, and that just means you need to have a HACCP plan start to finish where things are coming in to the restaurant and how you're serving them, exactly where and who and
I'm
how
surprised they
long.
don't have one, because seafood is a huge area of food poisoning, if it's
Yes.
not handled correctly.
Very big cross-contamination problem, so that's why we're looking at every HACCP plan with
Yeah,
fine
good.
tooth comb, and we haven't approved that one yet, but if you see raw shellfish at Perks, ask me if they've gotten their permit first. And then the other thing that I wanted to discuss was the
Can I bring up something really weird in relation to that? When you're doing that, I haven't been there in a year. I was there last summer. They have a real problem with their bathroom facilities they're really not sanitary. So if you're having people handling raw fish and their bathroom could use a lot of help with renovation and cleanliness, I don't know if that could be part of your, but that should be part of the same package if it's, if there's gonna be raw seafood there.
Is this a specific place that you're thinking of?
Perks,
They don't
right here.
they don't have bathroom facilities for their patrons.
you were talking about the place right over here, correct? In Harwich Port.
Perks, yeah.
Yeah, I've been to their bathroom during the stroll. You walk in and there's up the steps and you go into a very questionable bathroom. And if their employees are using it and they're doing seafood, it might be something that we just ask them what their
They shouldn't have a
policies are.
public bathroom there.
There might not be, but people do. I've been in there at least twice.
Yeah.
And my concern, not the public using it, but how are they, since it's very questionable sanitation in there. Let's
Right.
put it this way, being a dietitian, I know,
Well-
that was one of my specialties. Are they making sure that their employees use good practices when they're working with the raw seafood?
We went through that with Candy, as you know. The worst offender of all those raw seafood is mussels, by far.
Mm.
And I've never heard of anyone serving raw mussels.
Yeah.
I wonder, is that really allowed? Because mussels, to be blunt, sit in their own excrement. And when they're being prepared, it's real major risk. There are some mussels, as you know, that are deathly poisonous, like zebra mussels. But in any case, maybe it's not our purview, but it's certainly a public health issue.
I've had food poisoning 3 times with mussels.
Mhm.
Yeah. So that's why we want to make
Yeah,
sure
good.
that the
Yeah.
source is proper and the procedures proper.
Yeah, that's good. Protecting the public is
Yeah.
important.
And then the last part of my report I wanted to bring up was, we did get a complaint about Viprino's farm,
Oh.
35 Chatham Road. We hadn't heard from him in a year or so, but we did get another complaint about the odor and the flies. And just so we all have an answer, if you get asked about this, they no longer have horses, so we can no longer manage any sort of manure management plan. They no longer sell retail food, so we no longer have a reason to go onto the property.
Mm.
They are a farm. They are exempt from certain nuisance laws, including odor. So if you get a call and someone asks, why can't you regulate this odor? Because they are a farm and they are exempt from some general laws,
Mm.
including odor.
And USDA has been involved with them in the past when we were working on
Yes.
that.
Yes, and they, as far as I know, they still have animals there, obviously, if someone's complaining about odor, but they don't have any permits with the town.
I think it's the same lady
Yes,
that was making quite a stink, so to speak.
it is.
Okay.
So we can move on to new business if you'd like.
Sure. So we close the work session. New business, we'll open up the hearing.
We have a hearing for Hudson, 52 Ridgeport Drive, request to modify testing requirements of IA septic system. Mr. Hudson, you can come up to the table.
Hi. I'm here tonight looking for your help. By way of background, I have a IA advanced nitrogen septic system installed about 10 years ago. I have a 2-person house, 3 bedrooms, no garbage disposal unit. I live there 9 months here 9 months a year, and the system has been operating, as far as I know, perfectly for all the time. My maintenance cost in terms of parts in the last 10 years has been about $12. The reason I'm here is the system is costing me more than originally forecast. My cost this year for inspection, reporting, and maintenance, which is really nothing, the maintenance part is nothing, is $1,600. 2016, it was $1,200. I am requesting a reduction in the frequency of inspections or reporting and/or the parameters that are involved in some of the new parameters that are involved in all this reporting. I'm in the Ridgeport development. I'm the only one of 34 homes in the development that has this kind of system. I am not sure what agency, town, or state, which of those areas requires which kind of report, but I have a copy of the reports that I'm supposed to file so many times per year, the effluent, the influent, state, DEP, BOD, or oxygen, DO, whatever, and I just think it's a little excessive. My nitrogen, and I can get into the, some of the technical details here, although I'm not an environmentalist. My total nitrogen last year was typically 1.23 mgs per liter. That's pretty low, I think. The previous year was 1.62. In 2016, there was none detected. So I think, you know, when I first installed this, it's going to cost $1,000 for a couple of years, and then my reporting frequency would go down. Well, now, as you know, the reporting frequency has gone up, and they've asked for phosphorus total, I don't know, all these things, TSS, on and on. BOD, I think, is new. And so that's a summary. I wrote a letter to you, Ms. Eldridge, and said it was a little inaccurate, and I sort of tried to generalize. You know, not sure who's requiring what report exactly. I see the reports, I get the reports, but I don't know who's requiring them. And so that's where I'm need a little help here. But you know, we were just talking about nitrogen on lawns. My 1.23 whatever it is per liter is a heck of a lot less than a bag of fertilizer. So I'm making this request on the basis that I've had a system that's performed consistently with no way under any problematic levels. Just a personal remark, I'm retired, and you know, I see an increase that was more than the cost of living in percentage, and you know, I'm concerned. Why should I be paying this kind of $1,600 is a lot of money to me.
Sure.
To pay for reporting that I don't think is meaningful. And then I'll even say one more thing that might be a little off. The reports that I send to Boston, I doubt if anybody's ever read one. Ever. But I'm going to pay for it.
Right.
So that's the basis of my appeal. I summarize it. I can get into the details of my pH content or my turbidity if you want to.
No, I think we've got the gist of what you're seeking. So you're seeking a reduction in the expense to operate the system?
In either the frequency of all the reporting or the parameters.
Okay.
You added, in 2017, you added influent
Mm-hmm.
to the report requirements. And the influent is, my influent, of course, is treated. And it comes out better than when it goes in. The reports show that. And I just feel that you know, I talked to Barnstable. They sort of said, well, the town of Harwich has got one of the more stricter requirements in this regard. That's your decision, but I'm appealing part of that.
That's a fair
only
request.
because I think my system has been operating successfully.
Yep.
And you've got the record. And
Right now, we're testing it 4 times a year.
well, yes, I don't know whether you're requiring a 4-time-a-year report, but I'm submitting a 4-time-a-year report. I know part of it ends up in Boston.
Mm-hmm.
And then I have a report that goes to Barnstable, and then I know that you get the effluent twice a year and the influent once a year.
Well, let's see what the staff has to say.
The other part of this is that the sewers are coming, I believe. And if I'm going to be sewered, I don't understand why you want to have such a stringent reporting requirement on something that's going to go away in a few years, really. If you think that, you know, a 2-person house, after you see a 10-year pattern, is going to go off kilter, please say so. I doubt it. I think you have enough, you know, background to say, okay, this guy's
Yep.
not off, you know,
not a problem. And I will say, just as a matter of, off the subject, that nitrogen runoff is a problem.
Yep,
And
we're
it's
aware of
caused a
that.
lot of problems.
Right.
And I think that part of the reason is the sewering is, you have pond, pond scum or whatever it is, that's due to nitrogen runoff. What is it, Skinnicket Pond a couple years ago? The cemetery pond up here?
Well, let's see what we can do.
Yeah. So anyway,
Thank
that's
you.
another whole thing.
Okay.
So I don't, I was suggesting the parameters, maybe you don't have to have the phosphorus. I'm not technically enough to know what's most important,
I see.
but
All right.
Ready?
So,
I can answer some of your questions and probably some of your questions. This system that's installed here is called an Advantex system, and when it was installed in 2003, it was a newer system. Most alternative treatment systems were fairly new in the early 2000s. It's kind of when everything started to happen with those. So because it's a newer system, it was put in under a provisional approval rather than a general use approval, and that is why your once-a-year samples need to go to the DEP, the state. So that is why they get reports, and they do.
I'm in the general use category.
That you are now, yes, because that use has changed. The parameters set by the town are more stringent than those set by the state. We do include more parameters, and that was the prerogative of the board in 2003 when the IA system reporting requirements were put in place. Year-round facilities were quarterly inspections and 2 times a year sampling. One of the 2 times needed to include influent, and that was in place since 2003. So, because this has a great history, I do recommend that the sampling go down to once a year and the parameters be changed. So right now it's being tested for pH, TSS, BOD, ammonia, nitrates, TKN, and total phosphorus. And I recommend that we keep pH, TSS, BOD, nitrates, and TKN. Phosphorus is important when you're near a freshwater body of water, because that's what causes algae blooms. You're not near a freshwater pond. So it's good, useful information, but it's in this, we've been testing it for years. I think we've gathered enough data on that to be able to reduce that. And I do recommend going from 4 times a year inspections to 2 times a year inspections. Preferably in the beginning of the season when you first get there. You said you're there 9 months a year. So something maybe in the late spring, and then again before the fall starts, and have your samples, have your sample done later on in the year, once your system's been used for the summer. With these reductions, I recommend installing a time run meter on the system, and what that is an electrical piece put in on your system to show us how many hours the system runs. That's something they automatically put on systems now, so it's something that an electrician should be able to do for
I
you.
don't have that now.
Don't believe you have that now.
I know I have the emergency reporting.
Mm-hmm.
If there's something goes.
An alarm, yes, you have an alarm.
Yeah, okay.
Mm-hmm.
Okay, so it shows hours of operation.
Yes, it's called a time run meter. So when your
Yeah, I understand.
wastewater operator comes to do their last inspection, they can
Read the
write
meter.
down and put and report that, and that is to make sure we know the system's not being turned off and on, so we know it's being continually used. So those are my recommendations. It is a compromise, and I think it's reasonable. And people do read the reports. They go to Barnstable County, and they do read them. Yes,
I
sir.
asked them today.
Yeah, thank you. I was just going to comment. I'm not sure the requirements exactly, but Barnstable County does compile all that data.
Mhm.
And in fact, it's on their website.
Yeah.
You can read it, and it's important because the AI systems over the years have been very variable. A lot of them haven't worked as they've said, and you have a good track record, so I appreciate that.
Mhm.
Yeah.
The
Here's
one part for
here's
me-
the report, and they said they get 2,000 of these a year.
Yeah.
So that would be about 20
And
feet of
the,
paper.
And the runtime is, as Megan says, is critical because what we do know is that intermediate use of the system doesn't work as well. And so when you're gone 3 months out of the year, that's actually detriment to the efficient use
right.
of the system. I think that's also why Megan is to do it early on. But that information is looked at and continually revised. And the county actually, without this track record, they do recommend an increased sampling because of variability. I'm just not sure how well they work.
Well, I'd like to make a motion based on your recommendation. I think it's a very good compromise, and so I'd like to make a motion that we accept your recommendation, and that I'm sure that Mr. Hudson will get a written report, so that all the specifics of what you're suggesting, what time of year and all, is to everybody's satisfaction.
Second.
Okay.
All those in favor?
Aye.
Aye.
Favor? Aye.
Oh, he's been to more than one of these meetings, I guess.
Well, the motion passes.
Thanks a lot.
Yay.
Appreciate it.
Thank you, good luck with that.
Thank you.
Okay, thanks. I'll stay for the rest of the meeting.
The next hearing we have is for Ember to request a modified seasonal seating plan.
Good evening, everybody. We've been here before. I think it was about a year ago. I'm Matt Kelly. This is Judd Brackett, one of the owners of Ember. It's sort of been a long process to get to here. We've been pretty much everywhere else. I think we've seen Larry about 4 times. Fortunately, I think we're almost there. We got amended plans approved by the state, the ABCC, which led us to the selectmen, which led us to the planning board. 2 weeks ago now, we appeared in front of planning. All of the outdoor bars are now fully permitted, building, planning, we've been everywhere. What came up a little bit, what came up during the discussions on sort of the investigation in regards to how the structures looked was that there wasn't enough plans, I guess, on file with the Board of Health. The outside plans weren't matching what was on the ground and what was in the ABCC application. So what we tried to do tonight, at the request of Megan, was to give as many offset plans as we thought was reasonable. I mean, I don't know how familiar you are with Ember. Ember does a lot of events. I mean, sometimes there's a road race for the town out there where, half the town is outside and it's a town, but these are the reasonable, sort of the dimensions, the summer dinner, summer lunch, and winter. Obviously, there's not much winter lunch. So we're trying just to update the plans to make sure they're right or accurate as it relates to each time of year. Judd's here, can answer any of your questions, any specifics, and I'm happy to answer anything procedurally about how we got here. Welcome your comments.
Anybody, anything?
No? No questions?
Take the recommendation, the health inspector.
I've looked over the plans, and there are 4 different plans that were submitted. The winter plan has a total of 93 seats on the inside of the building, which they're allowed 99 full-service seats. The summer dinner plan includes the outdoor patio area with 10 exterior bar seats, 20 exterior patio dining seats, and what they do in order to trade seats from here to there is they take some seats from the inside bar and move them to the outside.
And we generally, even on the winter plan, I think you'll see there's, 8 across the front that we actually don't ever utilize. That's, that might be for someone waiting. So we've tried to show as many seats on it as possible. We actually probably operate in the winter at about 85
Okay.
comfortably.
So it's sort of
we actually
worst
can't get to, yeah.
Worst case, winter plan, summer plan, summer dinner plan. They move tables, they move seats from inside the bar area and put them outside. and bar area. They take some seats from the bar and move them to the outside bar.
And generally, our toughest time is May, early June, September, where we try to maximize some of the outdoor seating still, but it could be weather related, it could just be not be warm enough. You know, even this past Saturday with the rain, you know, so, you know, an outside plan obviously is not in effect during the rain, and we bring, you know, diners for lunch inside. Obviously, we try to maximize what we can outside while we have the season.
And then there are 2 lunch schedules for the summer. One is, looks like weather dependent with the outside being closed. And the other is nice weather with, it looks like the main dining area is not utilized.
Yeah, we
Okay.
put little reserves on each table inside that are out of service.
Okay.
We're still, even at full of what we can possibly do outside, I think it's 75 or 76. So, and I can say there are people that come in that don't want to be outside because it's too hot, and maybe don't want to be in the bar area where the tables and seats are elevated. So it does give us a little bit of room of about 4 or 5 tables in the dining room. Someone that wants air conditioning that doesn't want to be in a high area or in a bar setting with kids.
Okay. So you'd like to add in the summer lunch schedule
Yeah, I mean,
as
to not
76.
exceed 99, but it certainly would, you know, gives
to
us
include some
some
table,
if
inside
needed or
tables.
requested, yes.
Okay,
Yeah, I mean, there'd be a 23 seat that they
inside.
could put in there if they, you know.
I mean, we put them all, we list them all as closed. It's our same, like, our lunch staff is our lunch staff. So the servers that are there, that are expected to serve outside. If it rains, stay, and we transfer those seats inside. So
Okay.
we don't, on a sunny day, there aren't more staff or less staff. It's the same staff that's on, so with the same expectancy.
And how do you close your outdoor seating?
So our outdoor seating, when you see the lunch, there's the 2 6s that you see there are those long rectangle tables that are elevated. That is where we actually do our entertainment when we have it. So we don't do any dining on that side of the patio because it's just too close to where the music is and where people want to stand. And then the other 2, the 5 4-tops stay there. The other 2 actually become the service station for the servers out there, so.
Okay. So, looking over the plans, my only concern is it's weather dependent, and how are we gonna enforce that? If you have 2 different plans for lunch and one's, if it's raining and then,
Saturday was actually unusual, where it actually cleared around 6 o'clock and
Yeah.
became a viable night outside. Typically, we're either decided we're inside or out. Like, you know, the weather is usually consistent for the day.
yeah,
You know, and our lunch into dinner service, our dinner staff is in at 4. At that point, they begin some of their side work, which is part of the disassemblement of lunch, the setting up of the service station outside. So typically our reservations or anyone coming for dinner is 5:30 to 6, and we have a good lull to actually put the
Breakdown.
changes in place. The lunch doesn't travel that long. Maybe people still being lingering at the bar, but less so at table. So it makes an easy transition time, 4 to 5.
I just have
I
questions.
have a question. So was this plan that they're proposing now meet the specific questions you had on the June 14th memo?
It sounds like he is with, putting tabletop reserved or closed signs on the tables that aren't gonna be utilized, and using these two tops for service stations rather than seating, is a way for them to not have to physically remove the chairs, but not
The
seat
outside,
them.
even where the 6s and where those that we do remove, we put them into the basement, because if they stay out on the patio,
People-
someone takes them and then they end up in them, so it's
Yeah.
best.
Yeah,
that-
we had that issue last year when we were approving Cranberry Valley, and they were supposed to have signs, and the bottom line was they felt they couldn't enforce it because
Yeah,
people
because-
were,
And then
people
you're
come in and
asking
they're
someone-
like, what do you mean, there's an empty table, and they crash over to the empty table
And
against,
then you have a customer in a seat that you're then asking to
right,
move out of it.
Yeah.
It's easy, it's best, just, there's a shed out back and a room and space in the basement. The building has a full-size basement, so we have ample room down there.
Okay.
Does it matter to you or to anyone whether the tables are occupied if they're not serviced?
Yes, to me it does. I mean, if we have chairs at them, then they're in service, so.
No, I'm talking about there's no attendant. There's no wait staff assigned to that table. And people sit at it, they're not gonna get served. right?
Correct.
Yeah.
Correct.
So it doesn't really matter how many chairs you have, it's how many attendants you have, and what tables they're assigned to, right?
Well, it could
Not,
be.
not
could be,
exactly,
no.
because people will demand service.
Right.
Yeah, they.
You could have a fist fight there or
Yeah.
whatever.
Yeah,
You don't wanna put
I
them
think,
in
because I
jeopardy.
think you run the risk of, someone either then going to the hostess and placing an order, or going to the bar. You get into
Yeah.
carry-out type of scenarios.
So
We're
that's-
full service,
Cleaner
we're
if you
full
lose the
service, so.
seats.
Yeah,
Yeah.
I mean, we operate as full service, and we spoke about that too, and that would be our keeping, is how we want to keep it. I know back in the day, that was O'Neill's and Thompson's, and they were more of a counter service carry-out, but we're
Could pack them in, yeah.
And does this plan meet some of the things that came up last year about the noise level and the concern of the neighboring homes
Not our
of all the
previous,
people, huh?
not our previous.
Oh,
But I
okay.
mean,
So sorry.
We can address
but
it,
I
yeah,
mean, we
'cause-
can address it. I
Yeah.
mean,
Working on it.
Traffic.
Yeah, I mean, in compliant with the 10 p.m. outside, so
Oh,
our
okay.
entertainment, and we've had a clarification too, in terms of even, entertainment not just applying to, paid entertainment, whether it be a musician, but also the music that plays in the speakers, so, I was actually with Chief yesterday, and we talked
That's
about it,
good.
and
That takes
and
care of
he-
that.
we're very clear. We met with them in the fall and have a very organized plan as to
Good.
music and also even exiting the premise at night.
Great.
So we've
Yeah,
had a
there's
very
been a movement of the-
positive,
there's been a movement of the fence, to try to accommodate
It's
the
tough
foot
to be
traffic.
popular.
But I mean, and we're not doing it to be objectionable.
No,
either,
no, I
you
know,
it's-
yeah,
it's
people like
hard.
to go there,
It's- yeah,
including
it's-
myself.
it's-
Yeah,
Okay, do you have a recommendation?
I recommend that you approve the winter and summer dinner schedules, and as written in the summer lunch schedule, we can work out between staff to get something that's more concrete and not quite as weather dependent. So we can talk about what we can live with. So we're not saying, oh, it's sunny today, he's gonna have tables outside, it's raining today. So I recommend that we do approve the two out of 4 plans. In the last plan, I work out independently and work that out this week, so we can all agree on plans.
sounds good.
I move that the health director's plan be approved.
I'll second it.
We'll take a vote. All in
Yeah.
favor?
Aye.
Aye.
Thank you.
Thank you.
Enjoy the rest of the season.
Thank you.
It's a nice day. The last thing you have on your agenda is the approval of the permit list.
Yeah.
I lost
Get those over. Nothing.
You finally
Yeah.
did,
lost my
you finally did settle things, Megan, with the Japanese, the hibachi people. What do they-
Yes, we did.
Yes,
Yes. That violation of the holes in the floor for the
Yeah.
old vents has been corrected. They did
Okay.
clean up and seal the floor.
Good.
What was that in that,
Noble House.
mm,
Noble House.
Noble
right?
House,
Mm.
Yeah,
yes.
right. Okay,
it's good to
good.
know.
The one new food service establishment is Pleasant Lake Farm. It's really the only one of note, and he is a farm who sends his cattle out to slaughter and brings it back and sells it prepackaged, USDA stamped, frozen meat from his property.
Hmm.
So we do offer him a license so he can then sell the meat at farmers markets and other events.
Hmm.
I did an inspection. Things look wonderful.
Yeah, it's a good outfit.
It is.
All right, so can I hear a motion about the new permits?
I so move that the permit be authorized.
I'll second it.
We'll take a vote. All in favor?
Aye.
Aye. Motion passes. New permits are in and up and running. We have any other things, correspondence, this, that, the other thing?
I did submit correspondence in with the health director report. There isn't anything
So we're good?
outstanding.
Great. Can I hear a motion to close the meeting?
So moved.
Aye, agree.
Second? Aye. Meeting's ended. Thank
Do
you.
they still have those Herefordshire cattle out
Good
there?
job, Fran.
Yes,
Thank you.
yes.
Thank you, Larry.
One of them died, is that right?
I'm looking forward for Pam's
There
return.
were